So it will be on the website. And I think that's important for you to hear because there's lots of information on their slides. And they've assured me they're going to be going at warp speed. So don't feel like you have to get down all the information, because in the next few days, usually 2 or 3 days, we're able to get the recording and the PowerPoint up on our website. So if you just go to healthscienceconsortium.org/webinars, then you'll see our library of webinars that we've done over the past couple of years. If you're here live, we know that as teachers, you often need documentation of your professional development. So we are willing to provide you a certificate of participation. It's a 1 hour of professional development. And after the webinar today, you can just email me. I'll put my email. You should have it, but I'll also put it in the chat. So if you're interested in a certificate of participation, then just contact me and we'll get those out to you. So I don't want to take up any more of their time. Lois and Don have said that they would be willing to take questions at the end, and they're going to try to have about 8 or 10 minutes at the end for questions, but you can put some questions in the chat, and if it's appropriate, we'll sort of ask them to pause and answer that. But if not, we'll have some time at the end for you to give us your questions and answers, and they will provide the answers. So we're very fortunate today. We were just so honored when Lois and Donald reached out to the consortium to say, we want to provide this, real-time webinar to your teachers about COVID-19 and how law and ethics have been affected by this pandemic. And I was just like, how did you know about us? Have you ever presented to health science educators before? And Lois actually said, yes, I have. As a matter of fact, I was at your National Health Science Conference in Denver about 6 years ago. So she had heard of us and was very interested in giving information to secondary health science teachers. And she is an educator herself at the University of Reno, and Don is here alongside her and is an attorney. So we know he has a lot of expertise to share. So Lois, with that, I'll hand you the microphone. And I think you were gonna give a few more highlights about the two of you. And we look forward to you being with us today. Thanks so much for presenting.
Well, thank you, Nancy, and thank you for that nice introduction. It's exciting to present at the National Consortium for Health Science Education because it combines both of my loves, which is health science and education. So it's really nice to be here, and thank you for allowing us to have this opportunity to talk on this important topic. And so welcome to Law and Ethics in relation to COVID-19. My name is Lois, and as Nancy mentioned, I teach at the University of Nevada, Reno, and I also do consulting work. My doctorate is in education and my master's are in health science, one in social cultural anthropology, and one in healthcare administration. And I am thrilled to have Don here. Don is an attorney. He is licensed in both California and Washington. He has done criminal and civil liability cases, as well as worked on a lot of social sciences projects. Don and I have worked together on projects related to topics such as telehealth. And we also just finished the second edition of our book called Medical Law and Professional Ethics. So we're excited to be here. So thank you. So let's start with why this is important for educators. For about 9 years, I taught in health science at California State University, and now I teach in public health. And this situation that we're in right now in 2020 is relevant to both obviously a population perspective, but also a science perspective. So it's important for educators to be able to explain with students the resilient infrastructure we have related to law and ethics. And even though nothing has been normal this year, that framework has provided a structure to allow us to try and mitigate the damage from COVID and help to develop vaccines and things like that to help address it. So these framework can really be helpful. COVID, as you know, is very emotionally charged. We've seen a lot of emotion related to fights in stores, people not wearing masks. We've seen people, having out and out fights over this stuff. We've seen protests, and it's a very emotionally charged environment. The public health messaging, it has been very difficult for a lot of people to determine fact from fiction. Social media has played an impact on that. And also we're hearing different messages from different people and not really sure what that is. The other issue is that the public messaging changes. Originally we were told not to wear masks. Now we're being told to wear masks. The Centers for Disease Control and Prevention just changed the quarantine requirements yesterday. I was on a call with people who are addressing COVID all over the nation, and they said it's very confusing to have this change at this point in time. COVID has also illuminated health disparities and the social determinants of health. And I'm sure you're all familiar with the social determinants of health, being that health is related to a multifaceted array of things, such as economics. And we've seen that COVID has hit certain populations harder than others, particularly the American Indian population and the brown and Black populations as well. Scientific information and proper authorization. People are a little unclear as to who is the leader. We have Dr. Fauci out there who's giving us a lot of information, but then we hear other things from other people and from the pharmaceutical companies, and not really sure who that person is to channel that information. Is it the CDC? Is it Dr. Fauci? And it's really also highlighted the importance for emergency preparation, which in healthcare, we always talk about, and I know plenty of people who teach things about emergency preparation, but still don't have their earthquake preparation kit. So I think this has helped us with that, realizing that we need to be better prepared as a healthcare system. So what Don and I are going to cover today is we're going to do an introduction. I'm going to do a brief discussion on the science of COVID. And then I'm going to turn it over to Don, who's going to talk about the very complex legal framework in our United States and how the government has responded to COVID within that framework. And then Don's going to punt it back to me, and I'm going to talk about professional ethics within the context of COVID. And we'll do a summary, and we'll have time for questions and answers. So COVID has disrupted just about every part of every person's life, if not every part. Our work lives have changed, schools, businesses are closed, parks are closed, lockdowns are occurring, the gyms are closed, people can't get their hair cut, they can't travel, prisoners are being released. And so there's a lot of things that are going on, and with social interactions being limited, that limits our social support system in the midst of all this, and access to healthcare providers. And so it's been a very trying time. I think a lot of people have COVID fatigue, and that's been problematic. And the government and the first care workers, the healthcare workers, everyone is trying to balance the public welfare, keep people safe, reduce the spreading of disease, reduce the harm of the disease, but also that has to be balanced with the economic impacts of businesses being shut down, of state impacts. I know at the University of Nevada, we're going on furloughs because Las Vegas has been very hardly hit, the industry, and small businesses are being very much hurt by this. And individual rights have been challenged. We are in general a very autonomous nation. And we'll talk about that when we get to ethics. But a lot of challenges to the rules and laws have occurred. We've seen physicians arrested. We've seen business owners arrested. We've seen things going on airplanes because people have fought back about some of these new rules and laws. So COVID is a virus. It's microscopic. It cannot replicate outside of the host body. You may remember that triangle that has the host, the agent, and the environment. And so we need the host, which is the humans. The agent, of course, is COVID, and the environment is the ability for transmission. And COVID is transmitted by respiratory droplets when a person coughs, sneezes, or when they talk. It can survive on surfaces or objects. So if someone touches a doorknob, something like that, and then that future host touches some kind of portal of entry, it can enter into the new host. It can be airborne, and it can drift in the air to that new host. So some of the highly susceptible populations include older adults and people with medical conditions, people with diabetes, for example, and people in individual situations. Like I mentioned, it's really hit certain racial and ethnic minority groups, pregnant and breastfeeding women, people with developmental and behavioral disorders, and people with substance abuse disorders. And it's also affected specific settings, such as the homeless, newly resettled refugee populations, group homes. We've heard some horror stories about the nursing homes and the unprecedented deaths that have occurred in those. And as a result of this, these scientific recommendations have been made. And they're made specifically to reduce the spread of, by sharing these airborne droplets and aerosols from people and from surface contact, sorry. So that's why we wear face masks. That's why we socially distance. That's why we limit crowd sizes. We've also limited interactions within closed spaces. And even for like the holiday, it was recommended that people, eat outside and you keep your windows open and things like that. So any of these interactions within small spaces have very much been limited, if not completely prohibited. So this is as of 2 days ago. This is our number of cases. It's of course higher today. As you can see, the United States has the highest incidence of COVID in the world, followed by India. And as a result of this, we really created a lot of new laws and policies to prevent that continued spread. So now I'm going to turn it over to Dawn, who is going to talk about that legal framework in which these new mandates and business closures and things all took place. So I am going to stop sharing my screen and turn it over to Dawn. And Dawn, you're muted.
Okay, thank you. Let me get my, here we go. Okay, I'm sorry, can everyone see the screen now?
We can't see your screen, Dawn. You may have to go down to the right corner and press share.
I can see him.
Okay. All right.
You guys can? I can't.
I can't.
I can see him.
No, I'm seeing them.
Well, I can see.
Wave Don, it's Don Graham, right?
You
I can see Don, but we can't see his screen. That's what we're asking.
See his screen, yeah. I can see him.
Okay, how about for the sake of time, can you just do his slides for him there, Lois?
I'm happy to do that.
He'll just say
Don.
next.
Okay, that's fine then. Can you hear me?
We can.
Okay, so thank you, Lois, for
bailing you out.
Yeah, bailing me out of the techie. That's what health science is good.
We have learned flexibility this year, that's for sure.
Yeah. Well, anyway, thank you for your patience for a minute there. The situation we're talking about is a representative democracy confronting a global emergency, and the process in a democracy is basically pretty messy as far as communication, decision making, but in an intentional way. And from a young person's point of view, at this time in life, they're getting their prom dances canceled and their graduations delayed, and they're studying from home, and they're missing all the football games. And why don't the parents fix it? And what's going on? And how come the government that solved World War II is in such a mess right now, and we're having all this confusion and fights on the streets and things? And so we're going to look at one particular aspect of the society challenge there in addressing the pandemic, and that is from the perspective of law and ethics. And so today we're going to do a little presentation that we hope will provide a way for you to help young people and even adults understand that the government and their laws provide a structure, but there's flexibility to address emergencies and evolving situations. So first we're going to talk about a basic fundamental framework that most people have learned in secondary school, but maybe need a booster shot to remember some of that. And so then we're going to look a little bit at the current government's response, both at the federal and state level, examine a little bit about the controversy of some of the recommended interventions, such as face masks, and then some of the non-controversial changes. And then we'll talk about some of the, Lois will take it over and talk about some of the professional ethics that have been impacted or have been influential in addressing the pandemic response. So just in creating a framework which allows people to hang on to things in the face of adversity and the unknown, we're going to go back and talk a little bit about things that probably every student in the country gets educated on one way or the other, and whether it's retained or not is another thing. But so first we're going to look at the sources of law. This is foundational to everybody in the country. And of course, our basic framework seems pretty straightforward. There's a US Constitution that authorizes the establishment of legislation, regulations, and is surrounded by case law. And then the same kind of general structure at the state constitution level among the states, where the Constitution authorizes legislation and state regulations. And then local governments, county and cities implement ordinances and local regulations. And it's also impacted by evolving state case law. Now, in addition to that, we have additional complexity from the point of view of a national response to a pandemic, is that there are 50 state constitutions. And so the 50 state constitutions are regulating and controlling and influencing the laws and regulations being established by, or the ordinances established by the 3,175 counties across the country. And some cities and counties, of which there are 19,500, some of those jurisdictions have health-related functions, either regulations or licensing or permits or volunteer fire departments or first responders and so forth. So we end up with quite a number of moving parts that we're asking to respond to a internationally sourced emergency, and trying to respond in a way that is effective and safe. So the complexity alone is something that a lot of people don't quite understand, but we're going to have a good practical example here over the next 6 months when we try to distribute 200 or 300 million little glass bottles full of vaccine around the country. So that will affect every one of those 50 states, 3,000 or more counties, and 19,000 little cities and towns, plus all the rural unincorporated areas, all of which have been involved in this response to the COVID emergency. So Lois, go ahead to the next slide. Lois. Ah.
I'm trying, it's not moving.
All right.
There we go. There we go. Sorry, it wasn't moving. It wasn't forwarding.
Okay. So where are you, Lois?
I'm right here.
She forwarded it to the next slide.
I'm on slide 11, Don.
Okay, I can't see that at myself at the moment, but I'm going to just go ahead here. So let's look at this, the basic federal level that's supported by the U.S. Constitution. And of course, the Constitution is the supreme law of the land, but it really is a delegated power. So it's not totally comprehensive. It has a much authority on international affairs, including the prevention of disease coming into the country from international sources. And it has extensive authority for the economy and interstate travel and things that hold the country together among its many parts. And of course, it's balanced by the concept of separation of powers. Lois, the next slide. So the basic power for the interventions that we'll be discussing is from the Constitution related to Congress, which is empowered to create the budget and provide for the general welfare of the United States. That's the originating source of all the federal activity. And then if we go down to the next slide, Lois, the Congress is in charge of the budget and in creating programs, but it's the executive branch and the president that sees that those programs are further defined in federal regulations and actually implemented within both the program guidelines and the budget established by Congress. And many of these agencies have been involved in the pandemic response, Homeland Security, Federal Emergency Management, Department of Transportation, Commerce, Health and Human Services, the National Institutes of Health, which is under Health and Human Services, the Center for Disease Control, the Food and Drug Administration, Labor, the Department of Urban Development, Education, and the military have all been called on to respond in one way or another within the executive branch of the government to help marshal resources and respond in one way or another. Watching over all this is next slide, Lois, is the judiciary, which interprets constitutions and resolves conflicts and disputes among people that are because normally there isn't necessarily a consensus among the people as to what the actions are to be, but as agreement is reached and the process moves forward. So the Supreme Court and the judicial branches look to balance government intent and actions with individual rights defined in the Constitution and generally in the Bill of Rights. At the same time as that's all going on, the states have their own constitutions on a kind of a similar model as the federal government, with state legislatures, executives, and state courts. The state powers are generally broader and more expansive than the federal government, because they are vestiges of the original concept of individual autonomous states. So the actual implementation operations of health systems, police power, implementation of police powers, professional licensing, healthcare facility licensing, local permits, inspections, enforcement is generally run at the state level. And in part, that was some of the reason why the federal government delegated so much to the states. There's some, question about how communication and public health space occurred to help mobilize resources all in one direction in appropriate time. But the basic idea is the states do have more operational, practical authority in delivering service and operating in the health sphere than the federal government, that has direct health care responsibility for the military and the Indian Health Service, but otherwise can provide leadership and direction and research and so forth, but does not actually provide care to patients. Okay, Lois. Next slide, please. Oops. So the actions of both the federal government and the state government are restricted by their constitutions. And we have heard lots of controversy and argument and discussion about what the limits of the constitutional rights are. But basically, the general rule is under certain circumstances, the rights of individuals must give way to the public interest in certain situations. So generally, people have individual rights to free speech and assembly and so forth, but there's a limit to it. So for instance, under freedom of speech, individuals are not free to cause injury to others, say by crying fire in a movie theater, or self-justifying that they can enjoy drag racing on the residential streets because they have a right to assembly. So there's just, there are limits, and we're going to talk about that a little later in a little more detail. The authority at the state level, Lois, next slide, includes, in every state, there's authority provided to the executive for response in emergency situations. And those are extremely broad rules authorizing the exec to come up with solutions and intervene in situations, but are limited by time. They still have some of the limitations of the balancing of rights against the government interest that we'll discuss in a few minutes. But the state authority for the executive at the state level is very broad, but very limited as far as time. But it always involves some kind of need to declare an emergency, justifying the suspension of regular routine legislative processes. Okay, Lois, next. So let's turn now to how does all those moving parts, all that separation of powers, and all that balancing of individual rights and government processes, how did that all play out in our recent experience here with the COVID? For a country that was just coming out of a national impeachment process and tremendously involved political discussion, the whole nation needed to deal with identification of the problem, identifying the solution, implementing interventions, both for preventing the disease and also mitigating some of the damage to the economy and from the illness itself. And now moving to the point of just starting yesterday, I guess, the implementation of vaccine process that will hopefully mitigate this whole problem by next summer. So the US government, there was some executive action that, for instance, the president put some restrictions on international travel through his foreign powers and commerce powers from the government. So he restricted the travel from China and then Europe, and in trying to develop additional supplies and respond to more personal protective equipment and so forth. He used the War Powers Act that was already in existence. People were looking to the FDA to assess the effectiveness or possibility of development of vaccines. They looked to the CDC to conduct its usual disease surveillance and testing guidance that had been known for years. And then the legislature developed a number of interventions, special programs just for COVID, especially the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act, which is a remarkable piece of legislation we'll talk about in a minute. And other interventions such as the Paycheck Protection Act, the Paycheck Protection Program Flexibility Act, the Families First Coronavirus Response Act, and developing a runway to recovery program. But although there's a great deal of legislation at the federal level developed in just a couple of months, most of the actual response to the health issue was delegated to the states to operate within their traditional health implementation and delivery frameworks there. The feds did develop some testing protocols and worked on developing recommendations for prevention, such as face masks and social distancing, but there was not that much effort to dictate responses at the federal level. And one reason was because the pandemic hit the country in a variety of ways. First on the coast, basically, and then eventually into the interior of the country, so that a lot of the political jurisdictions and program development process within the legal framework were not triggered because the events were not occurring in the local area. So there was not as much of a priority in one area versus another. So there was a differential impact on the framework, but eventually the systems moved to develop what the local areas, the states or the counties decided would be their appropriate response. That was not uniform. That's what the United States is about, that the states can implement programs differently. And there certainly can be discussion as to whether it's been all good ideas or not, but it has been a evolutionary process within the context of that complex jurisdictional matrix framework we talked about earlier. Probably one of the biggest achievements of this year was the development of the Congress of the CARES Act, was a $2.3 trillion program that has incredible number of moving parts to it itself. It covers family and direct payments to individuals, unemployment, special grants for relief for bankruptcy, any number of different program responses. So Lois, would you go ahead, please? And again, I think. Okay, so let's see, Lois, one more slide, please. Yeah. So the,
I'm on slide 24, Don. Is that where you want to be?
yeah, 24.
Yeah, government response with the state personal protective equipment.
Yeah. So the state response was generally in alignment with the federal responses or recommendations, but to varying degrees. And there was still throughout this process the issue of balancing government need versus individual rights. And some of that will come up in Lois's discussion of the respective individual rights. But the basic idea was the government was attempting to develop interventions that were minimally impacted on individual lives, but effective against the disease. So if we go to the next page, Lois, at 26. One of the controversial things about the government's response is it's not that controversy was wrong. Controversy is fine because we have free speech and free discussion in America, so it's fine. But the reason there was so much discussion is because there was the concepts of rights to free speech, religion, assembly, autonomy, and so forth were pretty much all involved in those simple recommended interventions to prevent the virus. So whatever the individual right is in the Constitution, it can be balanced against government interest depending on how critical is how much impact it has on individual rights. So there are three tests for balancing government interests against private individual rights. And it's reasonable governmental interest needs to be rationally balanced against the reasonable interest of the government. If it a little more intrusive, it takes an important government interest to and substantially related to that government interest to interfere with speech and religion and assembly and so forth. And on very important core values to individual rights, the state must have a compelling interest that is narrowly tailored to the important or compelling state interest to protect society or prevent damage to the community. So Lois, one more. Lois, could you, 27, there we go. So let's just look at the example of face masks as one of the COVID interventions that to this day is raising controversy and fistfights and people being hauled off airplanes and so forth. But there is a long-standing process by which intervention by the government to protect people against disease has been recognized. One of the earliest cases was in 1905 with the Jacobson versus Massachusetts. That had to do with smallpox outbreak, but it still imposed, it still authorized the government to act within a pandemic to authorize mandated vaccinations. Later in '74, there was some Marshall versus United States that again supported the government's ability to intervene to protect society, even though it impinged somewhat on individual rights. And the basic maxim of that is undertake an act to occur in areas fraught with medical and scientific uncertainties that the government was given a latitude that it was especially broad. And in this year, there was the KOA versus Hogan, which allowed for the legislature to impose the interventions if it was supported by data science and advice. So that theme has continued across the years, and there still needs to be the justification as to whether a face mask is necessary and is it supported by science. And you can discuss that all for a long time, because it can be said is a face mask an intrusion on an individual's body, or is it a mere fashion, or what is a face mask? And then is it scientifically based, and so forth? You can argue about all these for quite a while, but that's why it seems to be sort of messy. But the basic idea is that the law is based on and follows science as it currently stands. Okay, Lois, one more. So if the science is there and the rule is neutral and generally applied to everyone on a rational basis, it will usually prevail in the pandemic. As far as face mask, just in case it was considered to be an intrusion into the person's body, that there's still a substantially related effort to achieve a government purpose, which is to prevent the spread of disease. So it is still, it would be authorized under both standards. So Lois, another one? One more. 29, Lois. Okay, but the imposition of face mask or other activities by government order or emergency orders is restricted usually by time limits. So the controversy in Michigan this year about the face mask and other protocols were within the emergency powers granted by the legislature, but it was restricted to 28 days, and the governor did act within the time frame so that her activities were, or her orders and so forth, were found to be authorized. But that's not an unlimited power. It must be always done within the authority given by the state. So Lois, on item 30, the state responses extended, of course, beyond face masks. They went to social distancing and things as crowd size and closing and opening businesses and so forth. All of those activities needed to be balanced against the testing of reasonable time, place, manner, or reasonable government or interest, or urgent. A strict requirement for the government to achieve its ends. So, but not all the government responses on Lois, if we go to page 31, not all the government responses were controversial. There are dozens of changes made to regulations and laws in the country, such as in telemedicine, and some of these are on the slide here, where there were changes in billing processes or authority to do face-to-face medical visits over video rather than in person. Any number of changes occurred that were not controversial, but just were included as part of the regular programming, but did not raise much controversy as far as impacting individuals under their constitutional rights. So, Lois, I'm going to turn this over to you for the discussion of the professional ethics, which arose in any number of ways, but I'll let you introduce that topic.
Okay, well, thank you, Don. And of course, my dog just started barking. But you're right. I mean, like the telehealth laws were not controversial. And actually, I think if they go to reverse them, that's where we're going to see a lot of controversy because people have really gotten, once you give something, it's very hard to take it back. And people have really enjoyed being able to use those means of getting access to healthcare. So Nancy, just a quick question. How am I doing on time? Because when I'm sharing my screen, I don't see the clock.
Hi, this is Katrina. You have about 10 minutes left.
Oh, okay. I better wiggle it. Thank you, Katrina. I appreciate it. Okay. So thank you, Don, for doing that. And technology is not playing nice with me. So I really like this quote, which was by the council chair of the American Dental Association, which is, during this crisis, when everything seems in flux, it is comforting to remember that the values we pledge to uphold remain unchanged. So this is the consistent framework, right? Those values are still there. So even though we're providing care using telehealth instead, those standards, the standards of care have changed, but the values have not. And the methods in which the care is delivered has changed and greatly expanded. So let's talk about the 4 principles of ethics. Of course, there are more. Paternalism being one of them, which some people have had concerns with because paternalism is kind of big brother telling you what to do. And that's one of the things that people are concerned about with some of these laws and telling people that you have to be in your house at 10 o'clock at night. So in light of the time constraints that we have here. Autonomy refers to self-determination. So I'm going to go through these kind of quick. That self-determination has been impacted by a lot of these laws and a lot of these restrictions on peaceful gathering, quarantine. You go into a store and they're checking your temperature and asking you all these what would normally seem like very private questions. Where have you traveled? Where have you been? Contact tracing, who have you been around? And so a lot of autonomy has been taken away in the essence of providing safety for the society and the population as a whole. And people are not happy about that. That's why we've had a lot of these rebuttal things. Beneficence, the act of the best interest of the patient. If, a year and a half ago, you had told someone in a nursing home that they had to stay in the room and you'll feed them when they're ready and you can't visit anyone, it would have been seen as imprisonment, right? It would have been viewed as a punishment. But now that's our new standard of care, and it is to protect people, not to punish them. But that is how things are very, very much different in nursing homes. Non-malfeasance, which is first do no harm. We have, must meet these professional standards like wearing protective gear, PPE. We need new knowledge. I've spoken to some providers who are trying to get used to this telehealth and still understand all of these legal and all of the changes of COVID and the new technology, and avoiding these home-based interruptions when people are working from home, and unintended disclosures. For example, providers doing psychotherapy via telehealth, you know, some of them that I've spoken to have put noise machines outside their door in their office at home to try and protect the privacy of the patient. And justice, of course, is, you know, sharing these scarce resources, right? The N95 masks, the access to technology. I spoke to one place, FQHCs, and what they did was Amazon rounding, right? So because you were only limited, or you were limited to a certain amount of hardware, and now they needed to disseminate the hardware to the providers who are working at home. So they would have each person in the office buy some hardware from Amazon or various sites. So the justice was an issue of who gets priority. We're seeing this with the vaccines too. The CDC just came out with their recommendations as to who should receive them first. So as a conclusion, the US is the highest incidence of COVID. The science continues to evolve as information changes. We've also seen a distrust in science, the denial of the disease, and in part that's related to the evolution and the new information and the messaging. And as the science has evolved, so has the laws. So they provide a steady framework, these laws and ethics, but they are evolving. So why is this important? COVID is a wonderful case study for educators to look at topics such as public messaging, scientific information, how is it played out and how it changes and how people respond to those changes, the ethical dilemmas of, you know, locking people in their rooms and taking away their jobs, and that autonomy that we've talked about, as well as the others, and the role of politics in health. Politics has always played a strong role in healthcare, but we've seen it in multiple ways this year. So there are lots of different ways to incorporate these concepts into your classes, to enhance critical thinking, stir debates and discussion, and to teach about the complexities of the healthcare environment and how there's this balancing act of protecting society at the expense of individual rights. So here are the references, which I know Nancy's going to post the slides, so you'll have those. And now we'll open it up for questions.
And we have a little less than 5 minutes for questions, but
Sorry.
such good information. So please, if you have questions, post it in the chat. Are you able to see the chat, Lois?
No. I could stop sharing my screen, but if I stop, yeah,
Well,
I can't.
Laura and I can read them to you.
Thank you.
Okay. Does anybody have any questions? These are the folks to ask. Okay, let's see. What is
the take-home message? What's your take-home message, Dawn and Lois?
Well, from my perspective, the take-home message is that while we're all experiencing these changes and these, what some are considering a violation of ethical principles, we're seeing changes in professional ethics and standards of care, is to adhere to the law and to, you know, ask questions and to participate in webinars and to continue to gather information. But I would say the bottom line, one-liner for me is that our country needs a little more practice in dealing with these types of pandemics.
Oh, no. Let's please don't have any more practice. Let's have no more practice in pandemics.
Not real practice, virtual. You know, we need more preparation because there's been a lot of mixed messages, and when you have that and that confusion and those violations of ethical principles and people lacking of understanding, they tend to rebel and get frustrated a little bit more.
Yeah. One question that we have here is the concern of FERPA and basically during the contract tracing process, there's a lack of consent and people are, your personal information is being shared, whether you want it to or not. And so that's a question of concern. And then the other one I've seen a lot are, tell me the concerns related to, or not concerns, what do you think about a mask mandate? Will it happen? And will they be able to mandate vaccines? So those are 3 questions.
But we just have a couple more minutes.
I know.
So they're such good questions.
Right. So I would like to encourage everybody to please copy down their contact emails that are on the slide right here. And we would love to have longer to answer questions because there are so many things. And FERPA is a really big issue right now. And some of you might have even been in schools the last pandemic we had during H1N1 when the FERPA issue was addressed, and that if it's in the public interest and public health, that you're allowed to, during any contact tracing, you're allowed to reveal some of the information, but not necessarily the identity of the person who's positive. So what would you like to say in closing, Lois and Donald?
Well, I think
go ahead, Don. Sorry,
I think educators can, using the framework of the way the government is structured in all its many pieces, and the balancing act between individual rights and the government need for action, based on the 3 standards of rational basis and anyway, the balancing of federal rights, federal needs or governmental needs against individual rights is a balancing that always depends on the situation and is fact-based. And when anybody says the government's overreaching, you really have to go through the steps of saying, well, what is the problem? Is there science or evidence to support it? Is it time limited and balanced against individual, the imposition on the individual? And it is always an important process to go through and to understand. And it isn't always quick and it isn't always straightforward. But I think that is something that often leads to confusion, and maybe some of the basis for the fights and so forth we're seeing in the streets is that people don't fall back to what they learned in their secondary classes and just look to conspiracies and dictatorship theory rather than looking at what is the actual processes involved in determining what is the best action in a crisis.
I think that's a great answer. I know she's going to cut us off, so because
yes,
now Katrina's now the evil one. Did you guys see how I worked that out?
That was good.
Quick question: if we will get you the history of the chat, and if you wouldn't mind answering some of the questions, and maybe we can post a Word document next to the chat with your thoughts. Would that be appropriate?
Sure.
That's a great idea.
Okay,
Yeah.
and that way we can still get some of the answers, because I think that there was 3 or 4 great questions that I'd really love to hear the answer to myself. So,
Yeah.
and since it's all about me,
Well, you are the chair. You are the chair.
It was a great session, and we really appreciate your time.
Thank you. Thank you very much for having us, and thank you, Dawn, and thank you to Nancy. And it's a huge topic and very hard to cover in an hour, much less 20. So thank you.
Yeah.
And thank you
Thank you so much.
Thank you for reaching out to us with your offer of sharing this information, because we definitely would not have gone looking for it, I don't think, otherwise. So thank you so much, everyone, for attending, and look for the information to be posted as soon as possible with the link to the recording. Have a great day, everyone.
Okay.
Bye-bye. Stay safe. Wear your mask.
That's right.